Preeclampsia, a pregnancy complication that occurs as a serious blood pressure condition that develops during pregnancy. People with preeclampsia often have high blood pressure, hypertension, and high levels of protein in their urine, proteinuria. Preeclampsia typically develops after the 20th week of pregnancy. It can also affect other organs in the body and be dangerous for both the mother and her developing fetus. Because of these risks, preeclampsia needs to be treated by a healthcare provider. Left untreated, preeclampsia can lead to serious and even fatal complications for both the mother and the baby. The following are the common and dangerous complications of preeclampsia, which include 1. Preterm birth. Preeclampsia may lead to an unplanned preterm birth, which is the delivery of a baby before 37 weeks of pregnancy. Also, planned preterm birth is a primary treatment for preeclampsia. A baby born prematurely has an increased risk of breathing and feeding difficulties, vision or hearing problems, developmental delays, and cerebral palsy. Treatments before preterm delivery may decrease some of the risks. 2. Eclampsia. Eclampsia is the onset of seizures or coma with signs or symptoms of preeclampsia. It is tough to predict whether a patient with preeclampsia will develop eclampsia. Eclampsia can happen without any previously observed signs or symptoms of preeclampsia. Signs and symptoms that may appear before seizures include severe headaches, vision problems, mental confusion, or altered behaviors. But there are often no symptoms or warning signs. Eclampsia may occur before, during, or after delivery. 3. Fetal growth restriction. Preeclampsia affects the arteries carrying blood to the placenta. If the placenta doesn't get enough blood, the baby may receive inadequate blood, oxygen, and fewer nutrients. This can lead to slow growth known as fetal growth restriction. 4. Placental abruption. Preeclampsia increases your risk of placental abruption. With this condition, the placenta separates from the inner wall of the uterus before delivery. Severe abruption can cause heavy bleeding, which can be life-threatening for both the mother and the baby. 5. HELP syndrome, also known as HELP syndrome. HELP stands for hemolysis, the destruction of red blood cells, elevated liver enzymes, and low platelet count. This severe form of preeclampsia affects several organ systems. HELP syndrome is life-threatening to the mother and the baby, and it may cause lifelong health problems for the mother. Signs and symptoms include nausea and vomiting, headache, upper right belly pain, and a general feeling of illness or being unwell. Sometimes, it develops suddenly, even before high blood pressure is detected. It also may develop without any symptoms. 6. Cardiovascular diseases. Having preeclampsia may increase your risk of future heart and blood vessel diseases. The risk is even greater if you've had preeclampsia more than once, or you've had a preterm delivery. 7. Organs damage. Preeclampsia may result in damage to the kidneys, liver, lung, heart, or eyes, and may cause a stroke or other brain injury. The amount of injury to other organs depends on how severe the preeclampsia is. Taking a baby aspirin daily has been demonstrated to decrease your risk of developing preeclampsia by approximately 15%. If you have risk factors for preeclampsia, your healthcare provider may recommend starting aspirin in early pregnancy by 12 weeks gestation. Preeclampsia may also develop after delivery of a baby, a condition which is known as postpartum preeclampsia. To learn more about postpartum preeclampsia and the treatment of preeclampsia, like this video, share, and subscribe to this YouTube channel. Thanks for watching this YouTube video. We'll see you in the next one.